Some clinical tips for effective management. Sometimes in acute conditions, what you need to do, and just few clinical tips I would like to share, which I do in clinical practice. Many times you get cases of lichen planus, and your constitutional remedies goes for a toss. Say yes, isn't it in lichen planus? Many times you have these conditions where the remedies stop acting, and then you don't know what to do. This is one of the remedies which I have used very, very effectively, especially when there is lichen planus with bilious constitutions, a lot of acidity, a lot of nausea. And this condition, try using anthrococcali, and this will really many times even reverse the pathology along with your constitutional remedy or your indicated remedy, whichever approach that you use. This is one of the remedies. It may not be given in boric exactly the way it is as lichen planus, but I have highlighted lichen planus because it is used in clinical practice for now many years now. Since I am telling you, it is now for more than 2.5, 3 decades. The next, chrysorbinum. Now, chrysorbinum is one of the remedies which we use in ringworm also, but I use it many times in cases of scab, especially in the scalp, with lot of itching, and there is a foul discharge similar to mesarium. If your mesarium as a remedy doesn't work, use chrysorbinum, where there are a lot of scabs and there is infection below the scabs. It is very excellent remedy to reduce itching. As you saw earlier, rheumatism after skin disease or alternating with skin condition or eczema. If there is a rheumatism alternating with urticaria, you have urtica urens. Voila tricolor, this is something which I have used as an acute relief for cases of infantile eczemas, children, especially few months, 2 months old child, 3 month old child, where history is not possible. The mother herself is 3 month old. She doesn't know much of the child and you don't know what to do. These are the two important things which I generally take: itching, which is aggravated at night, and sweating while eating. For a child who has eczema in his early childhood or infancy, this can be one of the very good indications in as good as a constitutional remedy, because you already have a physical general along with it. It really works wonders. Voila tricolor. Tellurium is one of the very important remedies for ringworm, eczemas, but the most important thing is about this kind of lesions. If they are ring shaped lesions of eczema or a ringworm all around, that time you can use tellurium, and this is the classical clinical indication for um, tellurium. Copaiva, as you have skin troubles alternating with urticaria, I mean, the rheumatism, same way. If there's gastric troubles alternating with urticaria, you have copaiva. It is also useful remedy for acne, disfiguring the face, which is very similar to the second case that you saw of natrum. One of the acute remedies for such conditions can be copaiva. And if you have gastric troubles with urticaria, with the sensitivity for shellfish, copaiva is one of the remedies that will give you relief. Since you have something alternating with gastric troubles, and Triostium perfolidium will be one of the remedies for urticaria from gastric derangements. If there is some stomach problem and the patient gets into urticaria, before your constitutional remedy is not acting, use this remedy to give the patient relief. Ras venata, patient comes in acute exacerbation and he says he's feeling better by hot water. Till the time your constitutional remedy acts, you can give a dose of Ras venata to at least ease his problem. And that is the most important thing for the young practitioners that I need to tell you. That for actually in treating any skin conditions, giving relief is very important. And if you have to give relief, then you need to use something as a small remedy or a pathological remedy or a very small pathological simillimum to give relief. And these are the remedies that helps us. Sabina, one of the very useful rubs in female complaints, but I've used for warts in mucocutaneous junctions when rest of the symptoms match. If you see warts on mucocutaneous junctions, especially in the vaginal area, this remedy will be very useful. Many times you use only nitric acid and sepia, but Sabina is one of the very good remedies for such condition. Still not seeing?
No, sir. Sir, I think you'll have to. Yeah,
Now,
now we can see sulfur
yeah,
iodatum.
yeah. So this is one of the another remedy that I use, especially in cases of eczemas and ulcers, which are very, very severely discharging with pus. But what I have to see in this case is the involvement of glands, especially when there is the eczema of the face or eczema of the legs, and you see the glands involved, and that too painlessly. Then this remedy is a very good remedy. But in this, the most common thing will be the prostration. If you see prostration with separating eczema, sulfur iodatum really works wonders. Another very clinical tip for sulfur iodatum will be herpes of the lips. A lot of patients with recurrent herpes of the lips are very well responding to this remedy, sulfur iodatum.